But thank you for joining us at the Board of Health meeting. Looks like is joining. I'm going to admit him. And so I'd like to call this meeting to order and get an approval of the agenda. So moved by Councillor Francis, seconded by Deputy Mayor Shepley. All in favor, opposed, that carries. Any conflict? Seeing no conflict, I'm going to turn it over to the Acting Medical Officer of Health to provide an update. Dr. Nazatheri, the floor is yours.
Board Chair Costante, members of the Board of Health, my colleagues at the Public Health Service, thank you for allowing me to share my comments today. Tomorrow is World Tuberculosis Day, and it's a day worthy of recognition. In 2021, about 10 million people died of TB. 10 million people became sick with TB worldwide, and about 1.6 million people died of TB worldwide. Closer to home, in 2021, in Ontario, 700 people got sick with TB and 40 people died. In recent years, TB has killed people in Windsor-Essex. Tuberculosis has been making people sick for thousands of years, but it was only in the late 19th century was a bacteria identified as the causative organism. And that is when people finally surmised that this is truly an infectious disease. In the vernacular, there have been a lot of common names like consumption and phthisis. TB affects the lungs, and patients suffer quite a bit. They can get cough, fever, chills, weight loss. They can waste away. But what's not always recognized is that TB can also affect other organs. It can affect the bone, the brain, the skin, the lymphatic system. After World War II, if you developed TB, that meant that you were perhaps separated from your family, spend weeks to months in a sanatorium. The treatment was primarily good food, fresh air, and rest. And then antibiotics came along, and that changed the entire management of TB. Sanatoriums closed. Most TB cases now can be managed in the community. In Ontario, at the current time, there are certain communities that are particularly high risk for TB. Those are immigrants from countries where TB is endemic, people who suffer from immune-compromising illnesses, such as HIV, people on drugs which may suppress their immune system, people of Indigenous background, and members of our community who'd have insufficient housing. I was talking to our health unit epidemiologist today, a wonderful resource, and he reminded me of something. He said that Windsor-Essex has a large community of international students, both at the community college and at the university, and that too is a community at potentially risk for tuberculosis. What's not always recognized is that Windsor-Essex has had a public health service for more than a century. And the public health service has been committed and has been organized to try to advance the health of the community. So what is the health unit doing, and what is the public health service doing to mitigate TB? First and foremost, we're working with our community partners, hospitals, general practitioners, specialists, nurse practitioners, to formulate plans for people with TB. We work to get people who have been exposed to TB tested. When people are recognized to have clinically apparent TB or have been exposed and have latent TB, the health unit works with community partners to organize the appropriate treatment. The health unit gives out the medicines for free. And most importantly, the health unit works with others to educate the broader community. The management of TB is really a testament to the success of medicine, and it's a testament to the success of the public health service. And it's something I think we can all be proud of. But there's still a lot of work to be done in Windsor, and there's still a lot of work to be done beyond our walls or beyond our community here in Windsor-Essex. Thank you so much for allowing me to share my comments, and I'm happy to answer any questions.
Thank you, Dr. Nazatheri. Any questions from the board? Okay, seeing none, I have none either, but thank you for your presentation. and I'm sure if there's questions throughout this agenda, you'll be here, Dr. Nasdari, to provide support. Okay, I'd like to move to the approval of the minutes. Any questions, comments? Councillor Francis, you want to move? Seconded by Councillor Marignani. All in favor? Opposed? And that carries. The business arising, we'll start with the 2023 Board of Health Competency Self-Evaluation presentation by Christy. So I'll turn it over to Christy to provide a presentation there.
Thank you. I'm just going to share my screen. Okay, can everyone see that? I can't see anyone, so guessing that's a yes.
You're good, Christy.
Yeah, we can see it.
Perfect, thank you. So I'm just going to do a quick presentation just around the self-assessment competency survey that the board completed. There's a full information report in your package on page 6. So if you're looking for some more sort of lower level details, then I'll provide here. I think that information report should be able to provide those, and certainly I'm happy to take questions either during the meeting or certainly after. You can feel free to reach out. So just a quick reminder, and we did talk about this back in January when we first introduced the survey. So the purpose of this is really around getting a sense of Board of Health strengths, and it also helps us to identify opportunities for training and support. We are, as a Board of Health, under the Ontario Public Health Standards, required to conduct regular self-assessment questions and provide report backs to you all. There are 12 competencies that we really look at from the survey perspective. These competencies are developed, really it's a combination of information from not only the standards, but also our Board of Health bylaws, and as well as the Alpha Board of Health Governance Toolkit, which for our new board members, you'll hear more and more about Alpha as we go along, and certainly you'll read more about Alpha and some of the work that's done there through your education modules as you complete them over time. So for each of those 12 competencies, we asked 2 to 4 questions. Average scores were created, and I will go through those today on those 12 competency areas. As a part of the assessment, what we do is we have developed a satisfactory range, and that satisfactory range is really sort of that minimum layer where we would hope to have our average board competency lie in each particular topic. And what that means is that on that topic, if we've met that satisfactory range, we have a general knowledge, and at times we may seek expert assistance on particular matters, but in general, there's a good level of comfort from each of our members on average related to that topic. The optimal range is certainly, where we all aspire to work. That would be where our board could really perform actions and make decisions without any sort of expert assistance coming in externally from the board. These are all probably familiar to you. This was a self-assessment scale that was used. It was a range from basic to expert, and everyone was asked to rank themselves. And then certainly we develop an average as a part of this reporting back for the overall board structure. Just as a reminder, these are our 12 areas that we evaluated on. They range from communication and marketing all the way to risk management and legal, and as well as human resources. So in those first 6 competency levels, the Board of Health, on average, definitely achieved that satisfactory level. So across the board, when we look at leadership and governance, political acumen, communication, marketing, financial management, partners and stakeholder engagement, as well as human resources. On average, our board has a good level of knowledge there. From a satisfactory level, we hit that. We actually, from a leadership and governance perspective, which I think is very reflective of the makeup of this board, is certainly definitely broaching towards, if not meeting that optimal score. And so certainly I think that's reflective of the experience at this table, certainly within the municipalities and probably on other boards as well. So that's really great to see. On the remaining 6 levels, which range from strategic and operational planning, performance management and CQI, risk management, legal, health equity, and certainly public health programs and services, we, for the most part, reached that satisfactory score that we're looking for. I think this is a great opportunity here in terms of improvement. There's really no surprise here when we talk about things in particular for a new board related to public health programs and services. We recognize there will be a knowledge gap there. Health equity as well is another area. So what we'll do from that is take this information and we'll really turn that into opportunities and next steps. So our strengths, certainly this is a board that has a really high comfort level related to leadership and governance, political acumen, and communication and marketing. And our opportunities, areas that we're going to work on from a priority perspective, will certainly be knowledge of public health programs, health equity, and certainly some of the legal components, which also I think tie in with understanding and learning more about our Board of Health bylaws as an example. So our overall recommendations, and certainly translated to next steps, with which most have already begun. You've all received your first Board of Health module following the last board meeting. We've had a couple folks fill it out, so just a gentle reminder that the modules are really meant to support that knowledge gap, so trying to get us up to that green optimal line. So hoping that everyone takes some time to do that. You will receive your second module in the coming week or two, and that will have additional information, really getting to the meat and potatoes of some of that public health knowledge that we hope to help bring everyone up to definitely that satisfactory level, and certainly towards our optimal level. We're also going to give an opportunity on a quarterly basis for the board to provide feedback about Board of Health operations as well as decision making. So following the board meeting in the coming weeks, you'll also receive a very quick, hopefully only a couple of minute survey that will allow you to provide a self-assessment about not specifically your performance on the board, but certainly your perception of the performance of the board related to different categories so far. So on a quarterly basis, we will do that. We'll bring it back to sort of give everybody a gauge of how we think things are moving and progressing, which in particular for a new board, is incredibly important, definitely within that first year. So that's really it for the presentation. As I said, the information package and report is on page 6. So if you do have any information, those of you who requested individualized reports did already receive them. And so I'm certainly happy to take any questions that I can answer.
Thanks, Christy. Any questions from the board? Great, seeing none. We'll turn it over now to Eric, who's going to talk to us about communications.
Yeah, thank you, Mr. Chair. I wanted to take the opportunity at this meeting to review the communications updates that'll be provided with each monthly agenda package. Those are included to inform the board of what we're putting out as an agency, and to make sure that our board members are aware, as sometimes these are the types of questions you'll get from constituents within your respective municipalities around the Board of Health and your role on this board. And so we include this in each agenda package to make sure that you have a good understanding of the types of materials that are going out into circulation by the health unit, as well as just changes and trends in things like our social media following, in the ebbs and flows of media coverage, and anything topical or timely that we're putting out in circulation. So an example from this month's board package is the corporate marketing campaign that was launched on January 31st. And there's a summary of that provided. And so if ever there are any questions about, what's included within the package, the types of media engagements that we're doing, or you have questions that come to you from constituents or from people within your municipalities or the areas in which you represent, and you have questions about that, you can always feel free to reach out to Dr. Blanchette, Board Chair Castante, or myself on those matters, and we can fill you in on the types of things that we've put out in circulation. Very briefly wanted to advise you on this, as you'll see as a standing item in your agenda package.
Absolutely. Thanks for that background and context, Eric. Any questions on that in terms of process? Okay, seeing none, if I can just get a motion to approve the business arising, moved by Deputy Warden Bichetti and seconded by Warden McDonald. All in favor, opposed, and that carries. The consent agenda, any questions arising, comments from the board on any of the items under consent? Seeing none, okay. Can I get a motion to approve the consent agenda, moved by Councillor Francis and seconded by Deputy Mayor Shepley? All in favor, opposed, and that carries. There's no resolutions or recommendation reports, so we'll move to new business. And again, I'll turn it over to Christy to talk to us about the Immunization of School Pupils Act ISPA enforcement update. I think there's some good progress that's been made in the last little bit.
Yes, thank you. So most of you have probably seen and heard in the news media, which we have been providing daily updates, but very happy to report as of yesterday. So certainly there will be a different number in the morning, but we're working on compiling those records now. But we were down to only 603 individuals on the suspension list. So certainly that's still more than we would like to see, but it's way beyond that 50% mark from where we started on Monday. So really, I could not be more proud of the team here at the health unit. Our staff have been working day and night to support these families and support our schools to make it through this process, which in the end, certainly we're here talking about the number of individuals who are suspended, but the outcome here is not suspensions. The outcome here is coverage and protection from vaccine preventable diseases. And I do worry that that message gets lost sometimes as the word suspension is often used, but it's really around making sure that students are protected in order to protect themselves, but also for all of those students around them. So we've made some tremendous progress here. We'll continue to work through this. We work very closely with the school boards, particularly as we get down to those lower numbers, recognizing that individuals have different types of barriers that are identified, and we will continue to work with each of those families to make sure that they can get the vaccines that they need, get their records updated, and get everyone back to school as quickly as possible. So big thanks to our local school boards and all of our local schools for everything that they do. This is not an easy process for them either. We've seen high levels of foot traffic here at the health unit. Our team has been just magnificent. So I really can't say that sentiment enough to our board. Our staff here at the health unit, our vaccine nurses, our managers, our clerical staff have just absolutely done an amazing job. They have moved a mountain. They've moved 2 mountains within the last 8 months, and I could not be more proud to work with these individuals. So big thanks to them.
And big thanks to you too, Christy, for your leadership throughout this whole process. Any questions? Dr. Nazatari, I see your hand is raised.
If I could just supplement, I think the team has done a wonderful job bringing young people up to date, but it's particularly important when we recognize that there are cases of whooping cough in the health district. There have been 18 cases in these past few months. It is exclusively among unvaccinated or under-vaccinated young people. And the one thing that the Board of Health and the Public Health Service can do to minimize the risk of whooping cough being transmitted through schools is to make sure that young people are up to date on their vaccines. And it's particularly important at this time, given the rise in potentially communicable diseases. So I commend Christy and her team in bringing forth this successful strategy.
Thanks, Dr. Nazatari. I see Mayor Prue.
Yes, thank you very much. I'm just wondering, I mean, in my term on the Board of Health in Toronto and East York, all those many years ago, you hardly ever heard of anyone refusing to get their kids vaccinated. And then along came the pandemic, and and all of the stuff, people refusing. I know in East York we had to, some of the staff had to be let go and then brought back later, and all the malignment of the governments over what they were doing, trying to protect. Is there a blowback today? Is there more of a blowback today than there was in the past? Because even 602 still worries me.
Through you, Mr. Chair. So I just want to clarify. So the 603 individuals outstanding are potentially a combination of things. So they're individuals, as an example, who haven't updated records yet in our system. They're individuals who maybe need a vaccine and haven't received it yet, and then also will need to update their records and put those in the system. There is certainly under the legislation a process for exemption, both for medical reasons as well as for religious. And so we as a health unit, certainly our obligation under the law is to support individuals who are seeking an exemption, and we do have that. It would be irresponsible of me to give you a number or to tell you that, as an example, we've seen a rise. Anything I would say would be anecdotal. Certainly, I appreciate the sentiment around vaccine hesitancy. I think that's something widely we've seen as a result of the pandemic and some of the conversations and dialogue around vaccine. Certainly, though, we expect the vast majority of these outstanding individuals, the 600 number, to be in compliance with the regulations. And so that would either be up to date for vaccinations and or have successfully gone through an exemption process that is permitted under that legislation. So Dr. Nessatheri may want to supplement some of my comments. I couldn't put a number on it right now, but I think the sentiment around hesitancy certainly has been something on the minds of all public health professionals over the last 3 years of the pandemic.
I think from my perspective, patients are, this is my 30 year practice, and patients are definitely more informed today and are less willing to accept what the doctor says at face value today than they were when I first graduated. That being said, I think the vast majority of parents want to do what's best for their children and get their children vaccinated. But I do think that people are asking more questions, and those are entirely appropriate to ask the questions that might concern them about vaccination. That being said, I think that it is fair to say that there are probably more people reluctant to get their children vaccinated now than when I graduated in 1990. But looking at the numbers in the aggregate, I think we're achieving pretty good vaccination rates. I think the numbers will finally come out, but my guess is that we'll be overnight. My guess or my inference is that we'll be in a very good place. I know Christy doesn't like me talking about the numbers, but back in the envelope, I think for the high school students, there were 22,000 students in the health district in high schools, and I think less than 1,000 came up to date. So that would suggest we have coverage rates in the above 90%, which I think is a good place to be in protecting the health of young people. The one other thing I would share, and I may repeat myself on this, is that it's particularly important to launch young people into adulthood up to date on their vaccine, especially for whooping cough, because some young women will get pregnant moving forward out of high school, and we want them to be up to date, and we want those children, those newborn children, to be completely protected as best as we can. So thank you for allowing me to comment on that.
Thanks, Dr. Nessatheri. Any follow-up, Mayor Prue?
No, that's fine. I just wanted to get some professional feedback of what I was thinking, and they provided it brilliantly.
Thanks. Councillor Agostino.
I think you're on mute.
Councillor, you're muted.
Thank you, Chair. I appreciate it. I too have been following the stories of the immunizations and the students. I happen to live right around the corner from the health unit, and I've seen the long lineups of people waiting in line. I'm assuming those are the people that have been coming in for vaccinations. And I see these poor people out there standing in the freezing cold. And when I say long lineups, I mean long lineups. Is there any way we can help with that, or is the move to the university going to, in a way, eliminate people from having to wait outside in the cold to get, when the health unit needs to provide services like that?
Through you, Mr. Chair. So certainly we definitely had lineups, and that becomes a sheer volume. We were running on all cylinders here at the health unit. We had 3 floors operating to service clients all day for the last several days. I will just note, original notices around outstanding vaccinations did go out in November, and we have been running a catch-up process almost on a daily basis since then. And so certainly we recognize, that there's been lots of opportunity. Unfortunately, we do tend to see longer lineups on those particular suspension days when folks are reminded about the fact that they're outstanding. Very happy to report that although we did see lines, those lines were moving very, very quickly. We saw upwards of 150 clients to be actually vaccinated, even separate from the number that we also saw to update their records. So our staff were doing our very, very best to get folks through quickly. Happy to report today we had no lineups outside of the door. So that was really Monday and Tuesday, and for partial of Wednesday, but happy to report that's not something that you will see outstanding. In terms of space, I'll certainly defer to Dr. Blanchette moving forward. We do expect that on a process like this. The great news for the board and certainly community is that these 2 really big activities that we've done with the high school in September and our elementary schools now means that our health unit and our jurisdiction gets to move into what we would call maintenance mode. And so moving forward at the beginning of each school year, and even beyond that, working with our licensed daycares in the area, we can work to update records on a more of a maintenance level versus sort of these large activities where we're dealing with thousands and thousands of individuals and trying to get them up to date, where we're really looking at new individuals, either to the JK level or new students to our jurisdiction. So the great news is if all goes well, knock on wood, after the pandemic, certainly we see that not all always goes well, but we can maintain this moving forward, and our teams and the community won't necessarily have to go through a process like this again.
Awesome, thank you.
Thanks, Councillor. Ken, did you want to chime in?
Yes, thank you. Actually, Christy hit the most important point, was that this was a catch-up. So there was multiple years here of vaccination. However, to the question, Councillor, is with the university. University has been a fantastic partner, and I'm certain that if we were to approach them and we had a volume need for something like this, I wouldn't suspect it would be a vaccine piece. Perhaps it might be another element that we would have to address as a public health response. I have no doubt that Dr. Gordon and his team would do their best to help facilitate something for us to have a larger venue for a shorter amount of time to help the community. So again, the university's been such an amazing and outstanding partner to work with. Even the conversations we've been having continuously, we're meeting every 2 weeks as a steering committee to help move projects forwards and formulate these ideas. So I'm glad you brought that up so that we can at least address it. It's nice to have that option in the future, right, for those pieces from moving from this facility. So thank you.
Thanks, Ken. Councillor, any follow-up? Are you good? Good. Okay. Councillor Marignani.
Thank you. I'm just curious. I saw the lineups as well. Are the vaccinations only available at the health unit, or are they available throughout the city at pharmacies?
So through you, Mr. Chair, so both of our offices were operating every day with open clinics. Individuals can also see their healthcare providers for vaccinations and then send their records in. So lots of opportunities. Pharmacies do not provide these particular vaccines for school-aged individuals. Generally speaking, those are through their healthcare providers or primary care offices. So, but certainly the health unit, both of our locations in Windsor and Leamington, were open and offering every day. But we were definitely getting lots of records from healthcare providers and individuals who were booking their own appointments.
Very good. Thank you. Thank you for clarifying that.
You're welcome.
Thanks, Councillor. And I see Deputy Mayor Rob Shepley.
Thank you. Through the chair. Just a comment, first of all. My son, we found our son was on this list, and I think it was through COVID that we missed a vaccine, and we got him on there. Certainly wasn't to go against getting him vaccinated. But I did get a couple comments this week from a few parents trying to enter the information online, saying they struggled and it wasn't accepting it and saying it was invalid. So I encouraged them to fax it in. And I just wondered if maybe anybody else had that same problem entering their information, updating it online.
Through you, Mr. Chair, anecdotally, I haven't heard too many issues. Certainly, we know there's always challenges when you're entering. I would even say record-specific information. It does require information like lot number and date, et cetera. And so a lot of folks are using their yellow immunization cards. Sometimes, as an example, handwriting can be hard to read, and that can read to potentially some of those errors. So we always encourage folks who are having difficulty, certainly, to call us. And we can definitely help do that. We do a lot of sort of online support for different things like that. I know myself, I also have 2 school-age children, and I can tell you that I could not read one of the dates that was on those yellow cards. And so I certainly had a challenge myself. But yeah, we're happy to help anyone who's experiencing those. The most important thing is making sure we get those records in. So we're happy to help wherever we can.
Thank you for that. And Leanne got me the right information, and we got it out to the parents.
That's great to hear.
Glad it worked out, Rob. Thanks. Any other questions from the board? Okay, seeing none. Motion to approve this report, moved by Deputy Mayor Shepley, seconded by Mayor Prue. All in favor, Opposed, and that carries. I need a motion now to go into in camera. Moved by Councillor Francis and seconded by Councillor Marignani. All in favor, opposed, and that carries.